This conference will now be recorded.
So now we come to the thyroid gland. Actually, we can observe three unique features of the thyroid gland. Okay, features of thyroid gland. Number one, okay, manufactures hormones plus store and release. That's the one unique feature. And the second unique feature depends on external environment for raw material. Number three, richest blood flow when compared to all glands in the body. If you compare the all endocrine glands, so richest blood flow at thyroid gland. So I think these points are not available in Chauris and Vishamsi. That's why I mentioned here. These are the three unique features of the thyroid gland. Manufactures the hormones, stores and release whenever required. A gland just simply manufactures the hormones, release into the bloodstream. Blood is stored and release whenever requirement. That's the unique feature. Depends on external environment for raw material. That means iron. Okay, based on the iron, okay, it synthesizes the hormones. So depends on external environment for raw material. And when compared to the other endocrine glands, richest blood flow at the thyroid gland. So these three are the unique features of the thyroid gland. Now we come to the location and extent of the thyroid gland. Location and extent. So where it is located, can you guess? Where you have seen in the dissection of thyroid gland? Deep dissection of neck. Deep dissection of neck lo mana chusi. Now that dissection only going on in the dissection. So that is the location. So what is the location? ఎక్కడ ఉంటుంది? Can you guess the location? ఇప్పుడు చెప్పండి అమ్మా. You see this picture? In this picture I will show you. So with green arrow I am showing you thyroid gland. With green arrow I am showing you thyroid gland. So usually that present in front of trachea. So if you see the location, vertebral level, it extends from C5 to C7 vertebra and also extends up to the T1. So location in front of trachea and extent that you write now. So location, so in front of trachea and extends from C5 to C7 to T1 vertebra ante C5 to T1 actually. So C5, C6, C7 and T1. That is the extent of the thyroid gland. Now we come to the shape of the thyroid gland that already you know, that is the butterfly shape or H shape. that you know it. And measurements are also there. So 5 centimeters length, 2.5 centimeters width, 2.5 centimeters thickness. This is about the one lobe of the thyroid gland. That also we can see in the books. Now straight away we come to the coverings of the thyroid gland. Next one, coverings. So this is the one of the gland. Usually glands in our body, usually those are covered by the two types of the capsules. Number one, true capsule, and number two, false capsule. True capsule, number two, false capsule. So for this also, once you see the picture, so we can see this picture. In this picture, we can see the capsules of the thyroid gland. That means coverings. So number one, true capsule, violet color. I am highlighting that one. Number two, here we can see false capsule. Okay, true capsule and false capsule. We can see these two. So obviously, for all glands, true capsule is formed by condensation of glandular tissue. That is the true capsule. Like that, false capsule is formed by adjacent deep fascia. Whatever fascia is available nearby the gland, that forms the false capsule. Not only for thyroid, we can apply this for all the glands in our body. So here, true capsule is formed by glandular tissue, number one. False capsule is formed by adjacent deep fascia. And which deep fascia is present here in the neck? Usually, deep cervical fascia. Now we come to the which layer of the deep cervical fascia? Already I told you, this is present in front of the trachea. So you guess which layer is forming the false capsule here? Excellent. Pretracheal layer of the investing layer of deep cervical fascia. That forms the false capsule. Now we write down true capsule formed by condensation of glandular tissue and false capsule formed by pretracheal layer of deep cervical fascia. Pretracheal layer of deep cervical fascia. Then one more thing here, very, very important. Between true and false capsules, between the true and false capsules, so between true capsule and false capsule, between them, okay, we can see some contents, very, very important contents. That one is the parathyroid glands. Parathyroid glands. This could be highlight here. Clinically and surgically, this point is important. Okay, between the true and false capsules, we can see the parathyroid glands. Parathyroid glands, those are present. That's the one thing. And regarding the false capsule, this one is called thyroid gland, thyroid capsule or false capsule. And this false capsule usually connected with the trachea, another main cricoid cartilage. This one is connected with the cricoid cartilage, connected with cricoid cartilage, cricoid cartilage, and that one is called suspensory. That one is called suspensory ligament of Berry. This is another point. Suspensory ligament of Berry. This is another point we have to highlight. So this is about the coverings of thyroid gland. So in the coverings of thyroid gland, mainly you highlight 2 points. Between true and false capsules, parathyroid glands are contained, most important one. And false capsule is connected with the cricoid cartilage through suspensory ligament of Berry. That's another point. Because of this connection, usually thyroid gland it moves with respiration and trachea to move avutundi because of this connection. That's one point. Okay, and the venous plexus of thyroid gland usually present deep to the true capsule, unlike the prostate gland. దాన్ని దీన్ని మనం ఎప్పుడు కంపేర్ చేస్తాం. For prostatic venous plexus are present between true and false capsules. Here, venous plexus are present deep to the true capsule that we can compare. So this is about the coverings. Now we come to the parts and relations of the thyroid gland. Parts and the relations of thyroid gland. So you have already seen in the dissection thyroid gland. So generally, normally, what are the parts of the thyroid gland? What are the parts of the thyroid gland? With dissection lo chusaru kada ma, can you guess? What are the parts of the thyroid gland? Two lobes and connected by isthmus. Total ga 3 parts untayi. Very good. Somebody is replied. So 2 lobes and connected by isthmus. So lobes are pyramidal in shape. Pyramidal shape. Lobes are pyramidal in shape. Now first we learn the parts of the lobe. So if you see the one thyroid lobe, if you see generally, already I told you it's pyramidal in shape. So what parts we can expect? First one, apex. Okay. And second one, base. And third, what we can see, borders. And finally, we can see the surfaces. Each lobe of the thyroid gland. So base, apex, borders, and surfaces. You see one by one. First, we see the parts of the thyroid gland. Then after that, in the picture. Then after that, we see the relations. So you see this picture. Is it visible? For example, this is the picture A. This one is the picture A. So in this picture, we can see the parts of the thyroid gland. Okay. This is the one lobe, pyramidal shape. This is the second lobe, another side. Both are connected by, this part is called blue color one. I am labeling isthmus, horizontally connected by isthmus. So if you see the one lobe of the thyroid gland, what are the parts? Lobe of the thyroid gland. This one is the apex with black hair I am showing, and this one is the base. Okay, and between them we can see the surfaces, borders, Okay, and usually whatever you see in this picture with black color line I'm drawing, this is the posterior border of thyroid gland. Along the posterior border of thyroid gland, we can see the two pairs of glands. What are those glands? Name them. Parathyroid glands. Parathyroid glands are present. Occasionally, one more lobe is present, third lobe, with black color arrow I am showing. Third lobe is also present. That one is called pyramidal lobe. So this also we can see. Occasionally, third lobe is also present. That one is called pyramidal lobe with black color arrow I am showing you. So these are the parts of the thyroid gland. Okay. And now we come to the relations of the all these parts. Now we see the relations of the all these parts. So we take another picture for the relations. So we can see this picture. This one is the, we name it picture B. This one is the picture B. So in this picture, first we identify the base and apex with the green arrow. I'm showing you base and apex. So this one is the apex A, and this one is the base. You can see the two parts, base and apex. So first we see what is the direction of apex, upwards and laterally. That is the direction. So usually apex is related to two structures here, one artery, one nerve. So with red color, with blue color, okay, with blue color circles I'm showing you. Apex is related to one artery, this one, and one nerve. So can you name these two? What is that artery? Superior thyroid artery. Apex is related to. And related to which nerve? External laryngeal nerve. So these are the relations of apex. That one. And next to another point, usually apex is sandwiched in between two muscles, two structures. It is usually sandwiched in between two structures. That one is the oblique line of thyroid cartilage, and number two, sternothyroid muscle. So this is about the relations of apex. Now we come to the base. So base is related to here one artery, one nerve, like the apex. Here we can see that artery. That artery is the inferior thyroid artery. Okay, inferior thyroid artery. I'm showing with blue color circle. And a nerve. That nerve is the recurrent laryngeal nerve below that. So these are the relations of the base. Got my point? Usually inferior thyroid artery, it forms the loop at the base of the thyroid gland. So these are the relations of apex and base. Now we write down relations. So base usually present between, I told you, two structures. One is the thyroid muscle. Another one is the thyroid muscle. Another one, oblique line of thyroid cartilage. And related to apex and related to external laryngeal nerve and superior thyroid artery. So these are the relations of apex. And base, what are the relations of base? So base is related to one nerve, one artery, that is the inferior thyroid. So inferior thyroid artery, that nerve is the recurrent laryngeal nerve. So these are the relations of base. Now, usually borders are 2 in number, anterior and posterior borders. Along the posterior border, we can find the glands. Name those glands. What are the glands we can see along the posterior border? Parathyroid glands. Parathyroid glands we can see along the posterior border of thyroid gland. Now finally we come to the surfaces and their relations. So already we have seen the apex, base, borders, and finally we see the surfaces and relations. There are 3 surfaces. Can you guess the surfaces of the thyroid gland? Number 1, lateral surface, దాన్ని superficial అంటాం. Number 2, medial surface. Number 3, posterior or posterolateral surface. Posterior or posterolateral. So these are the 3 surfaces we can see at the lobe of the thyroid gland. One lobe of the thyroid gland. There are the 3 surfaces: lateral, medial, and posterolateral. First, you see the picture. Based on the picture, we try to learn all the surfaces relations. Okay. So I'll show you the picture for this. So this is the main picture. So based on this picture, you can learn the relations of thyroid gland for surfaces, and also this picture is used for the deep cervical fascia. In this picture, we can see all the layers of deep cervical fascia and their attachments. So this is a good picture, not only for thyroid gland. We can use it for the deep cervical fascia, carotid sheath, and thyroid gland. So this is the main picture. So in this picture, we are going to learn the surfaces relations. So first, we identify the thyroid gland here with the black color. I am showing you. So this is the transverse section of the neck we are taking through the thyroid gland. This is the picture. So here first I show you that this gland with black color I am writing. This one is the thyroid gland. So in this picture also we can see the ligaments of the thyroid gland. Ligaments. So whatever you see surrounding the thyroid gland with black hair I am showing you with green color, that one is the false capsule. Already I told you. So false capsule is formed by pretracheal layer of deep cervical fascia that we can see. And here with yellow, with red color, I am showing you suspensory ligament of Berry. Usually that is present in between the, here trachea is there. Above the trachea you imagine the cricoid cartilage. So like that. That means inside of the false capsule. Okay, that we can see that connection between the false capsule and cricoid cartilage, that is the suspensory ligament of Berry. Because behind this ligament, not in front, behind this ligament, okay, behind this ligament, one nerve is passing. That nerve is the recurrent laryngeal nerve. This relation is important. Later I will explain. Right now we see the relations of thyroid gland. So in this picture, first we identify the surfaces. With red color I am showing you the surfaces. So this one is the superior surface or lateral, superficial or lateral surface, L, I put L. Towards the trachea, whatever you see, this one is the M, medial surface. Obviously towards the carotid sheath, this one is the posterior or posterior surfaces. So So in this picture, for one lobe of thyroid gland, I have shown three surfaces. Lateral surface L, posterior surface P, and medial surface M. Now we come to the relations of the surfaces. Towards the lateral surface, here we can see the four muscles. There we can see the four muscles. So just I am writing the abbreviation in the notes. Anyhow, I will extend. This muscle is the SCM, sternocleidomastoid. That's one muscle. And next one, sternocleidomastoid. Sternocleidomastoid. And next one, sternothyroid, that one. And this one, superior belly of omohyoid. Superior belly of omohyoid. Total ga, we can see the four muscles. Sternocleidomastoid, sternocleidomastoid, sternothyroid, superior belly of omohyoid. అంటే ఒక మాటలో చెప్పొచ్చు, except thyroid అది తప్ప infrahyoid muscles plus sternocleidomastoid. What I am telling that infrahyoid muscles except thyroid అది తప్ప plus sternocleidomastoid, they form relations for lateral surface of thyroid lobe. That's one thing. Okay. Now we come to the P, anaga posterior surface. So posterior surface is related to kanipistundi. What is that sheet? CS, carotid sheet. Posterior surface is related to carotid sheet and its content. Now we come to the medial surface M. So medial surface is related to here two tubes. Number one, trachea, and number two, esophagus. TO. I'm labeling, blue color labeling చేసాను చూడండి. Number one, trachea. Number two, esophagus. That's the one. And also, this surface is related to two nerves. In this picture, we can see one nerve only. In higher level, one more nerve is also there. So this nerve is called external laryngeal nerve, ERN. Plus one more nerve is also there. Sir, this nerve is the, whatever I'm showing blue color, this nerve is the recurrent laryngeal nerve, RLN, and one more nerve also related here, that is the external laryngeal nerve. So two nerves, and two muscles are related in the medial surface of thyroid lobe. Those two muscles are, can you guess the two muscles? Those are, in this picture is not shown, but those two muscles are, one is the inferior constrictor and another one is the cricothyroid. These are the two muscles. So this is about the relations of the three surfaces. Once again, lateral surface is related to superior belly of omohyoid, sternocleidomastoid, sternohyoid, sternothyroid. Picture you see, in the picture you see. And posterior surface is related to carotid sheet. And medial surface is related to two tubes, thyroid and esophagus, trachea and esophagus. Two nerves, recurrent laryngeal nerve, external laryngeal nerve. Two muscles, inferior constrictor and cricothyroid. So these are the relations of the surfaces. Same thing we write in the notes. So here three surfaces. So now you tell me, I write the surfaces relations. For lateral or superficial surface is related to sternocleidomastoid muscle, sternohyoid, then sternothyroid, finally superior belly of omohyoid. These are the lateral surface relations. So medial surface is related to two tubes. Name the tubes: trachea, and esophagus. Then two nerves. Name the nerves: recurrent laryngeal nerve and external laryngeal nerve. And two muscles. Name the muscles: inferior constrictor and cricothyroid. Cricothyroid. That's one. Then posterior sheet related to carotid sheath. So carotid sheath contains common carotid artery, internal jugular vein, and the 10th cranial nerve vagus. Is it clear? Okay, na? So these are the parts and the relations of lobe of the thyroid gland. What we have seen here, parts and relations of lobe of the thyroid gland. And next we come to the isthmus. I tell you only 3 points about the isthmus. That is enough. Because clinically important these points. That's why I'm telling you. So next one, you see the isthmus and relations. So isthmus is present horizontally, connects two lobes. Okay. In the isthmus, we can see the important surface, important points when I'm telling, not all the points. So posterior part, posterior surface, above another superior border, SB, and below another inferior border. So posterior surface, okay, present in front of 2, 3, 4 tracheal rings. This point important. Tracheal rings. And above, it is related to superior thyroid artery. Below, usually from the lower border of the isthmus, below one vein is emerging. That one is called inferior thyroid vein. He points to identification points in the dissection. That's what I'm telling. So this is about the isthmus. Is it clear? This is about the isthmus. Now we come to the blood supply, nerve supply, and the lymphatic drainage. So first, next one we come to the blood supply. So first one by one is see arterial supply and venous drainage. Can you see this picture? Kanbistunda? Can you see?
Yes, sir.
Can you see this picture? Okay, now?
Yes, sir.
Okay. So in this picture, you see the arterial supply. Two arteries are supplying two pairs of arteries. Number one, what is that artery?
Superior thyroid.
Superior thyroid.
Number two, inferior thyroid artery. So superior thyroid artery is the branch of external carotid artery. So inferior thyroid artery is branch of thyrocervical trunk of
Subclavian artery.
what is that artery? Subclavian artery.
Subclavian.
So in this picture, we can see the course of the two arteries. Superior thyroid artery from above towards the apex. Inferior thyroid artery from below towards the base. Usually, superior thyroid artery is accompanied by one nerve. What is that nerve? Can the labeling on the below that nerve? External laryngeal nerve. Similarly, inferior thyroid artery is accompanied by recurrent laryngeal nerve. This relation is very important. Occasionally, very good. And occasionally, I'm showing you third branch, number 3, is the direct branch from the arch of aorta. Dani thyroidemia artery అంటే లేదంటే సింపుల్ గా ఆర్టీరియా ఈమా థైరాయిడ్ ఏ బుక్స్ లో అయితే మీకు అలా మెన్షన్ చేస్తారు. ఈ డౌన్లోడ్ పిక్చర్లు ఇలాగ ఇచ్చారు. సో ఆర్టీరియా థైరాయిడ్ ఈమా, ఓకే, దట్ ఈస్ అకేషనల్లీ. డోంట్ ఎక్స్పెక్ట్ ది థర్డ్ బ్రాంచ్, జనరల్లీ అకేషనల్ గా ఉంటుంది. మెయిన్ గా ఇన్ఫీరియర్ అండ్ సుపీరియర్ థైరాయిడ్ ఆర్టరీస్. అయితే ఒక పాయింట్ ఇక్కడ క్లియర్ గా అబ్జర్వ్ చేయండి. మెయిన్ గా మీరు చూడాల్సిన పాయింట్, నియర్ ద ఎపెక్స్, ఎల్లో కలర్ యారోతో చూపిస్తున్నాను, సరే నాట్ ఎల్లో, గ్రీన్ కలర్ యారోతో చూపిస్తున్నాను, నెంబర్ ఏ. సో నియర్ ద ఎపెక్స్, సో ఎక్స్టర్నల్ లారింజియల్ నర్వ్, ఇన్ఫీరియర్ థైరాయిడ్ ఆర్టరీ ఆ మధ్య కొద్దిగా డిస్టెన్స్ ఉంది. దే పాస్ ఫార్ అవే, కొద్ది దూరంగా పాస్ అవుతుంది. బట్ నియర్ ది బేస్, అనదర్ గ్రీన్ యారోతో చూపిస్తున్నాను, నియర్ ద బేస్ downward loop of the inferior thyroid artery is caused by recurrent laryngeal nerve. అంటే బేస్ దగ్గర ఇన్ఫీరియర్ థైరాయిడ్ ఆర్టరీ నర్వ్ రెండు కూడా ఒకదానికోటి క్లోజ్ గా, ఇంటిమేట్ గా, క్లోజ్ గా పాస్ అవుతాయి. అంటే అటు క్రాస్ చేస్తుంది అనమాట. అంటే ఎపెక్స్ దగ్గర ఆర్టరీ నర్వ్ మధ్య డిస్టెన్స్ ఉంది, ఫార్ అవే పాస్ అవుతుంది. బేస్ దగ్గర ఆర్టరీ నర్వ్ రెండు కలిసి ఒకదానికి ఒకటి క్రాస్ చేస్తూ పాస్ అవుతుంది. ఈ పాయింట్ సర్జికల్ గా ఇంపార్టెంట్. సో దిస్ ఇస్ అబౌట్ ది ఆర్టీరియల్ సప్లై. దెన్ వి కమ్ టు ద వెనస్ డ్రైనేజ్. నౌ వి కమ్ టు ద వెనస్ డ్రైనేజ్. సో same veins, whatever arteries you see, those arteries are accompanied by the same veins, but here we add one more vein. This is the venous drainage of the thyroid gland. So there are 3 veins we can see for each lobe of the thyroid gland. Number 1, superior thyroid vein. Number 2, inferior thyroid vein. Number 3, okay, number 2, middle thyroid vein. Number 3, inferior thyroid vein. So in this picture we can see 1, 2, 3 thyroid veins. Arteries అయితే రెండు ఉన్నాయి. In case of vein we add middle అన్నమాట. So superior thyroid vein, middle thyroid vein, inferior thyroid vein. Let me tell, superior thyroid vein is draining into which vein?
internal jugular.
Internal jugular vein. అనగా superior thyroid vein, middle thyroid vein, both veins drain into internal jugular vein. Then inferior thyroid vein is draining into left brachiocephalic vein. ఈ పాయింట్ కొద్దిగా హైలైట్ చేయండి, క్లియర్ గా చూడండి. ఆల్రెడీ ఐ టోల్డ్ యూ, inferior thyroid vein usually emerging from lower border or below the isthmus of thyroid gland. పిక్చర్ లో చూడొచ్చు. And that is draining into brachiocephalic vein. అది 1. And one more vein is there, that vein is clinical vein. Clinical గా ఈ vein చాలా చాలా important. With black color circle I am showing that vein. Okay, with black color circle I am showing this vein. Can you hear me? Can you hear me? Yes or no?
Yes, sir.
Can you hear me? Yes. Okay. So with black color vein I'm showing you, that vein is the Kocher's vein. మీరు క్లినికల్ గా వెళ్తే సర్జన్స్ దే ఆస్క్ దిస్ వెయిన్. సో దిస్ వెయిన్ సమ్టైమ్స్ ప్రెసెంట్, వెరీ వెరీ ఇంపార్టెంట్ క్లినికల్ వెయిన్. దిస్ వెయిన్ ఇస్ కాల్డ్ Kocher's vein. ఇది ఒకటి హైలైట్ చేయండి. బికాస్ ఇఫ్ యూ వాంట్ టు డూ ది థైరాయిడ్ సర్జరీ, we should ligate all the veins. So usually we expect the number 1, 2, 3, ఆ 3 veins expect చేస్తాం. And occasionally 4th vein is also present. దాన్ని Kocher's vein అంటాం. So before you are doing the surgery, We look for Kocher's vein, whether it is present or not. If it is present, it should ligate that vein. Is it clear? So this is the venous drainage. And next we come to the nerve supply. Nerve supply by the autonomic nervous system, mainly by visceral branches from middle cervical ganglion of cervical part of sympathetic trunk. Because sympathetic trunk lo adi explain chestam ee section lo vinandi. So mainly branches are coming from middle cervical ganglion of cervical part of sympathetic trunk. Adi nerve supply. And lymphatic drainage, you know it. So lymphatic drainage, cervical lymph nodes. So this is about the thyroid gland. Briefly, I explained the thyroid gland and quickly, and this is good enough for you, these notes. And here I want to highlight some points. So I completed okay, special features, location and extent, coverings, parts and relations, including the isthmus, and blood supply. In the blood supply, we have seen the arteries, veins, nerve supply, venous drainage. Okay, up to here we completed regarding the thyroid gland. Here I highlight some points, and these points are very, very important surgically, in a clinical aspect, surgically. Okay, very, very important. Those points I'm highlighting just with only. So I went one by one, I tell you. So first one. So first one, we come to the coverings of thyroid gland. If you come to the coverings of thyroid gland, here I told you one ligament. What is that ligament? What is that ligament? Here I told you one ligament. What is this ligament? Suspensory ligament of Berry. Suspensory ligament of Berry. That we can see here. Behind this ligament, suspensory ligament of Berry, behind this ligament, one nerve is passing, that is a recurrent laryngeal nerve. మీకు రిలేషన్ లో చూపించాను, ఇది ఇంపార్టెంట్ రిలేషన్స్. అంటే while you are doing the thyroid surgery, okay, while you are doing the thyroid surgery, you may cut the capsule of the thyroid gland. That time you have to careful about the recurrent laryngeal nerve. దాని వెనకమాలే ఉంటుంది. You should not cut that ligament. అంటే లైఫ్ సేవింగ్ nerve అన్నమాట, అది very, very important nerve. So this point we have to highlight, number 1. And number 2, between the true and false capsule, thyroid gland, parathyroid glands are present. If you remove the thyroid gland along with the capsules, true and false capsule, that leads to death. Why? Because parathyroid glands are present in between the true and false capsules. Parathyroid glands are maintaining the blood calcium level. This is essential for the mainly working of cardiac muscle. That's why if you remove the inadvertently capsules of thyroid gland along with the thyroid gland during the thyroidectomy surgery, removal of thyroid gland, enlarge అయినప్పుడు goiter condition లో, you should careful about the parathyroid gland. You leave the posterior part of the thyroid gland because parathyroid gland are present along the posterior border. So this point also you have to highlight in the coverings, number 1 and 2. And now we come to the parts of the lobe of the thyroid gland. If you come to the parts of the lobe of the thyroid gland, I told you apex. Apex is present in between the two muscles. What are these muscles? Apex is present between two muscles. What those name those two muscles? Okay, name the two muscles. Not thyroid, this one, sorry. So cricothyroid. Apex is right, thyroid only. So apex is present in between the two muscles, thyroid muscle and oblique line of thyroid cartilage. Number 3, చూపిస్తాను చూడండి. Because between these two, apex is present. Because of this only, during enlargement of thyroid gland in goiter condition, we can see the enlargement of thyroid gland in the towards the base only, lower aspect only, not towards the apex. Endukante apex is present between these two. These are not allowing the upward enlargement of thyroid gland. That's number 3. And next we come to the apex only. Another point, number 4. In the apex only, we can see the number 4. So apex is related to external laryngeal nerve and superior thyroid artery. So near the apex, there are these two structures are far away. Rendu duranga untai. That's why during the thyroid surgery, we ligate the inferior thyroid artery close to the apex. Endukante we can avoid the external laryngeal nerve. Dani duranga untundi kabatti. Number 4. And number 5, we come to the base of the thyroid gland. Near the base, inferior thyroid artery, recurrent laryngeal nerve, both are crossed and daggaraga untai. That's why during the thyroid surgery, we ligate the inferior thyroid artery away from the base. Endukante a nerve injury ni avoid cheyadam kosam. Ante near the apex, we ligate the superior thyroid artery close to the apex. Nerve elago dooram undi kabatti, external. Near the base, we ligate the inferior thyroid artery away from the base because the recurrent laryngeal nerve is crossing the inferior thyroid artery. That's number 5. And next we come to the number 6. So during removal of thyroid gland, we retain some posterior part of thyroid gland because along the posterior part or posterior border, we can see the parathyroid glands. That's number 6. And now we come to the surfaces. You can see the lateral surface, medial surface, and posterior surface. We have seen the important relations. And next we come to the isthmus. Usually, posterior surface of isthmus is present in front of second, third, and fourth ear rings. And this is the ideal site for doing the tracheostomy. Midline structures of neck lo cheppam. So this is the site for doing the tracheostomy. This is the number 7. So this is about the importance of thyroid glands. Here in entire notes, here I highlight the 6 points. These 6 points kosame man thyroid gland chaduvutam. Whenever you go clinical site, you should remember these 6 points. Number 1, recurrent laryngeal nerve is passing behind the ligament of Berry. That's number 1. Number 2, parathyroid glands are present between true and false capsules. And number 3, apex is present in between thyroid muscle, oblique line of thyroid cartilage. Because of this only, we cannot see the upward enlargement of thyroid gland. Thyroid gland goiter condition lo lower part posterior enlarge avutundi gaani superior ga enlarge avadu because of this only. And number 4, okay, apex is we can ligate the superior thyroid artery close to the apex because the external laryngeal nerve is away from the apex. That's number 4. Number 5, during thyroid surgery, we ligate the inferior thyroid artery close to the base. We ligate the inferior thyroid artery away from the base. Because near the base, inferior thyroid artery is crossed by recurrent laryngeal nerve. Then avoid cheyadam kosam. Number 6, during thyroid surgery, surgeons they leave the posterior part of thyroid gland because along the posterior part, parathyroid glands are present. These are the essential glands for surviving the individual person, maintain the blood calcium level. Number 6. And number 7, posterior surface of isthmus is related to second, third, and fourth tracheal rings. So this is the site for the tracheostomy. So this is about the thyroid gland. Briefly, I explained all the parts of the thyroid gland, including the clinical importance. I mentioned here 7 points, and also remaining clinical importance. We can see physiologically. What are the types of the goiter? What is the goiter? Okay, and other details we can learn in the physiology. Is it clear? Any doubts? Emma, class is over. Any doubts?